Good afternoon, everyone. Thank you so much for joining this webinar. So, this is the Association of Future African Plastic and Reconstructive Surgeons, and you're all honored to be a part of this, our very first journal club that we'll be having today. And this will be um, like a sneak peek into the research fellowship program that we'll be having next year. So I would like to introduce myself. My name is Jonathan Aye Nuamah. I'm the research director at AfroPRS. And today we'll be discussing a paper on the on burn-related issues in Ethiopia. And my assistant Piel will be the one presenting. So I'd like to introduce you to him. Piel, could you go to the next slide, please? So Piel is an early career researcher with a strong dedication to neurosurgery, neurology, public health, global surgery, and the application of plastic and reconstructive surgery in pediatric neurosurgery. He has made significant contributions to several manuscripts published in the esteemed international peer-reviewed journals, including World Neurosurgery, International Journal of Surgery, Neurosurgical Review, and Annals of Medicine and Surgery. As a dedicated leader and aspiring neurosurgeon, Kuol is passionate about advancing healthcare through research, leadership, and mentorship. In his capacity as the research director at Moi University Research Club and the assistant director of research at AfroPRS, he spearheads the collaborative efforts aimed at driving impactful research initiatives. Furthermore, as a member of the Association of African Future Neurosurgeons, he actively engages with a community of professionals committed to advancing neurosurgery across Africa. So, Piel, I would like to give you the floor now, and you can start our journal club.
Good evening, everyone, and good morning from other people from part of the world. So we are honored to have you today. This is our introductory of our first journal club of AfroPRS. So you are highly welcome today. So for you to, maybe some of you may be having questions, what is going to be the benefits of this journal club? So this journal club is going to improve your education because we are going to be doing the papers. We are going to be discussing papers which can improve your educational background. By the end of this session, you are going to know more about the first 8 bands. Apart from knowing other things like improving your presentation skill. In the upcoming presentation, other members that are going to do their presentation, and by the end of it, you are going to gain some skills to improve your critical appraisal skills of a scientific paper and to inspire research ideas. By the end of this paper, we are going to get some ideas on how we can do the similar research, maybe by doing the same methodology or focusing on the limitation which they left out during the study design. During this paper, what are we going to look out for? So we are going to look at the study design. What study design was employed during this study? Was it appropriate for the research question? The methodology, were the method clearly described by the authors? Sample size, was the sample size representative of the population affected by the study phenomenon? Then we are going to look at the results section where the finding statistically significant and thus the data justify the conclusion. Then we are going to look for other things like the funding, who funded the research, ethics. Did authors acquire ethical approval from the review board? So which are the important things we are going to look out for? Conflict. Does this paper have any conflicts of interest arising from the authors? And was it discussed in the paper? The limitation, which is the important part of it. What are the scientific limitations of this study and how it was highlighted in the study? So then the outline of the paper, we are going to look at the the outline, we are going to look at the title, we look at the background, we look at the objective, the method, the results, and the discussion, and the conclusion, like a normal paper. So to begin the title, this is our title. It was investigating the knowledge, attitude, and practice toward the burn first aid and its associated factors among caregivers attending burn units in Addis Ababa, Ethiopia. And this was a cross-sectional study, which we are going to look at this was the design which was employed in this study. Then the authors, these are the authors and the year of publication. This paper was published in 2022.
Piel, can I just say one more thing? So
Okay.
I'd like the audience to put their questions in the chat so that we discuss it at the end of the paper during the question session. This will be a very interactive webinar, so you can continue.
Okay. Thank you, Jonathan. So this is the title. So later on, we are going to discuss everything about the title. So let me do a presentation, and then next we can dissect each section by each section. Thank you. So what is a cross-sectional study? A cross-sectional study, by definition, this is an observational study that analyzes the data from a population at a single point in time. And we have a good images here where you can visualize the difference. And then we have another study design, which is a longitudinal study. So this is a good illustration. You can see now from these slides. A cross-sectional study, you can see this is just a single point of time, and you are collecting data from a different source. While longitudinal study, the source is just the same, but you are collecting data from a different point in time. So the background of the study, so which is the important part of it, when you are writing your proposal, a background should be clear for you to know what are you going to investigate. So burns are major global public health concern with a high mortality and disability rates, particularly in low and middle income countries. So you can ask yourself why at the end of it. So we are going to say burns are fourth most common type of trauma worldwide, and definitely the leading part of it in low and middle income countries and other part of the world definitely are traumatic brain injuries. They result in approximately 300,000 deaths annually, which is a bigger figure, raising concern. Then burns contribute to morbidity, increased hospital stays, and disability. Almost 2/3 of the burns injuries occurs in low and middle income countries, particularly in Africa and South Asia. So burns impose significant economic burden, and in 2019, the global microeconomic burden of these injuries was estimated to be about 6.1 billion US dollars in sub-Saharan African and 11.7 billion in South Asia. For arising from these burns issues, the limited research exists in community level knowledge of pre-hospital burn management in Ethiopia, related to other part of the Africa part and other countries in low and middle income countries. So Ethiopia burns injuries are prevalent. Inadequate public education on burn first aid contribute to poor outcome. The Ethiopia Demographic and Health Surveys report that the burns injuries account for 8.7% of all significant injuries in the country. Inadequate public education on the first aid burn, injury prevention, and the control method, as well as lack of resources in funded health facilities, contribute to this poor outcome of these burn injuries. Okay, then we can go because this study you can look at the objectives, and most the objectives should align to the title. So we have 3 objectives here. The first one is assess the caregiver's knowledge, attitude, practice regarding burn first aid. The second one is determine the socioeconomic factors associated with burn first aid knowledge, attitude, and practice. Other one is to provide the recommendation on how these burns can be improved to the Ministry of Health of the Ethiopian government. The methodology. So methodology actually is the backbone of any research. When it's not conducted well, so it's like a compass of the study. So the study design, we said it was a cross-sectional, and the hospital-based cross-sectional study conducted from December 2021 to January 2022 at 2 different hospitals in Addis Ababa. As I said, cross-sectional, you are collecting from different sources, but at the same period of time. These are the 2 hospitals which were the data was collected. The study population, caregivers who are 18 years and above were recruited to participate in the study during this period. Inclusion criteria, all caregivers of burns patients aged 18 years and above were included, and those healthcare workers were excluded during the study. Variables, we have what are variables? We have 2 types of variables. We have independent and dependent variables. The independent variables, this is variables that change, and dependent ones, this one is affected by the by change, and we can see from we have good examples from this study. So from our study, the independent variables includes things like age, sex, marital status, educational levels, occupation, income, previous burn, first aid training, past burn history, information source, health facility, accessibility, and the area of the residence. While dependent variables include things like knowledge, attitude, practice related to burn first aid among caregivers. The sample size is very important because it should represent the population. Yeah, so it should not be too big and it should not be too small, because when we do the data analysis, like when we do the inferential statistic, we can estimate and it can be presentable of the whole population. So we have different methods which we can use during calculation of the sample size, and mostly which is widely used is Kerry-Morgan. Yeah, and this is the formula we usually use at your own time, so you can look at these actually contain the things we are going to look at, so I will not go into it. So it's just a simple one. So sampling technique. So we have different type of sampling techniques, and this study they chose to use a simple random technique from 2 hospitals, so that we don't get too much data from one side and we'll leave out this one. So we try to balance so that it can present the 2 hospitals. So there's, as I said, there's simple random sampling to enroll participants in each hospital was employed. Data collection was collected using a pre-tested structured interviewer administered questionnaire. And it contained different parts which I will not go into too much. So it has the socioeconomic, demographic part of it. There was part of knowledge, attitude, and practice related to the burn based on our title and the objectives we had from the beginning. Data collectors were trained and nurses working in the burn units, the ones who were administering the questionnaire. So the data analysis. So from this one, after the data was collected using EPI data version 6, so the data was uploaded to SPSS, and we have other data analysis tools we can use. We have Stata, we have R, but they chose to use SPSS, IBM SPSS, and the version which was used is version 26, and now we have around 31. So, and then the descriptive statistics and the multiple logistic regression were used to analyze the data. So the descriptive statistic is like the age, we are doing the mean, we are doing the mode, we are doing the range. Yeah. Then the multiple logistic regression was used to analyze the data. We are trying to figure out the association. And then the significant was said to be around p value of less than 0.05. This is based on the hypothesis which the authors formulated. Like maybe they say that most of the caregivers, they don't have knowledge. Maybe their level of knowledge is low. So we can either reject the null hypothesis or we accept based on this one. When it's too small, maybe when they calculate it, it was less than this one. So now the null hypothesis was rejected and they go for the alternative hypothesis. We say that these people are not aware. So the data quality assurance, this is how to make sure that the data is complete and it's updated and does not have errors. So the daily checking for the completeness and the consistency of the data throughout the data collection process was done. Then the pre-testing of the questionnaire to assess the reliability and the estimated data collection time was done. So for you to make sure that your questionnaire is valid, so it should be tested first to see what are the things to be ascertained from that questionnaire so that it can be given out and is correct. So the result section. So the total of 305 caregivers participated in the study, and this is the representation. 185 were female, representing 60%. Then the main source of knowledge was families, friends, colleagues, and guardians. Around 246 of these caregivers did not take any form of the band's 8 training. So this is making their level of knowledge to be significantly low. So 202 had poor knowledge on band first aid, and 195 had poor band first aid practice. So then 225, which is representing 73.8%, had favorable attitude regarding the band first aid. So the discussion of the results. So we are trying to correlate the results from other published papers from other part of the world. So like 66% of the caregiver demonstrate poor knowledge of the band first aid, similar to findings in Indonesia. And 62%, which is 62.6% of the caregivers demonstrate poor band first aid practice, higher than in Saudi Arabia. So the discussion, the cold water application, this is the techniques they are using to do the first aid regarding the burn. So only 39% of the caregivers apply cold water. Many did not know the recommended duration. So we should have a certain duration of time which is supposed to apply cold water. So during our awareness, so we provided all first aid which is going to be done. The traditional remedies, the higher use of the traditional remedies like down, oil, were observed to be used by other people which are participating in the study. So the favorable attitude, the caregivers with the favorable attitudes had better practice. So because the training part of it, the caregivers with the previous ban first aid training had better practice because they are taught on how to do it. So what are the strengths and the limitation of this study? So the strength of this study is that this study was applying analytic cross-sectional study design, which enabled the authors to find out the association between the knowledge, attitude, and the practice of the caregivers and the associated factors. So on the other hand, the limitation of this study, so they did not have person to do the qualitative part of it. So at this one, maybe it could be better if they could combine like the mixed method to be a cross-sectional, another part to have the qualitative design, so that they can ask, like they do interviews, so that they can see the so that they can observe the actual things while they do them, so on how they do them. So the practice assessment part was based on what the study participant told the data collectors without the latter observing the actual practice during the burn injury. So the conclusion should tie in to the objectives and the result part of it. So this study highlights the significant gaps in the caregivers' knowledge, attitude, and practice regarding burn first aid in Ethiopia. So the first aid education, this study strongly emphasizes the need for the target burn first aid education program for caregivers within the community. As we say, the pre-hospital care is a major issue in most of these low and middle income countries. This program should focus on the effective and safe burn injuries management techniques. So the prevalence of the traditional remedies, many caregivers still rely on the traditional home remedies for burn treatment, which lack scientific evidence and may be ineffective or even harmful to those who are affected, the victim. Cold water application. The use of cold water are globally recommended first aid measures for burns was found to be low among caregivers, which means that most of them that are taking the prevalence, which is the traditional remedies, instead of this cold water, which is more scientific, maybe because of the training that they are not provided for. Further investigation. The study recommends further investigation into the specific traditional and alternative methods used by the caregivers to treat burn injuries. So that's the end of the presentation. Yeah. So the author's declaration, the ethical permission was obtained from St. Paul Hospital, from the Institutional Review Board, and the permission was taken from Addis Ababa Burn Emergency Trauma and the second hospital they were doing in, and the funding received like 455 USD, and this was funded by the St. Paul Hospital Medical College. This research was funded, I've already said that. So thank you. Any question?
Thank you very much, Piel, for that very insightful presentation. So, yes, so we have not received any questions from the chat, but if anyone has a question that they would like to ask, they can unmute themselves and ask. So I've gotten Shirley first. Shirley, do you have a question you'd like to ask? Oh, okay. How about Haran? Haran Gochu, you raised your hand.
Yes. I would like to ask a question.
Sure.
about the interpretation of the concept of cold water application as a globally accepted and recommended pre-hospital intervention, considering one of the issues arising from burns is hypothermia, and application of cold water might actually sometimes exacerbate that. So is it cold water application or room water application? There have been debates around that.
Yes, so Haran, that's a very good question. So literature suggests that there is a ideal temperature and ideal duration to apply to the burnt area as a first aid. So I don't have the ideal temperature off head right now, but the ideal time of application of that temperature of water is about from 20 to 30 minutes, if I remember correctly. So yes, there are some temperatures that make the first aid worse, like hot water or even like ice can make it worse, but there is a scientifically accepted temperature that you're supposed to use. And it's also not just the temperature, but the duration. If you do it too short, it will have no effect. If it's too long, it could have a worse effect. So that's a very good question. All right. So Benjamin, your hand is raised.
Yeah. Thank you. Yeah. Thank you so much for the opportunity to ask my questions. So first and foremost, I'd like to appreciate Piel. I call him the charismatic panther. This guy is quite a I love his dedication and his diligence when it comes to research. And I didn't know he was so active with plastics as well. I knew him for his neuro studies. He's published quite a few in association with other African students, and this is really great work that he's doing. So with regards to this one, I was just curious to find out about more the methodology, particularly what kind of research data collection tool they use. I think I missed it. There was a point where the net was a bit shaky, so I kind of missed a few of his presentation. But I just want to find out, was the questionnaire or whichever data tool, was it in English or was it in Aramaic, which is I think that's the Ethiopian language? Was it in the local language, and what were some of the considerations that they took to overcome some of the language barriers if it was in English? Secondly, maybe what does the literature demonstrate in terms of the kinds of burns that are in Ethiopia? Are we dealing with more of scald burns that are caused by water, hot water injury, or are we dealing with fire contact kind of burns? And typically, what kind of degree of burns are we talking about? I know maybe the research focused on the caregivers' attitudes, knowledge, and practices, but maybe in terms of literature, what does it say when it comes to the type of burns that are in Ethiopia? I'll be quite curious about that as well. I think those are my two questions, and I'll be curious to find what the answers are.
So those two questions are very good. So with the first question, I am not sure which language the questionnaire was administered in. I'll have to look through the paper in more detail to find out. However, this paper did state that it was the questionnaire was data collector administrated, which means those who were collecting the data assisted in the collection of the data through the questionnaire, and those who were doing the data collection were nurses. So I'm sure that if maybe someone could not speak English and the questionnaire was in English, the nurses would have translated it for them, or the other way around. So we can't make assumptions with papers, right? That one has to be the work of the authors. However, that could have been the case. So that's a very good point you raised. It should be explained in the method section. And for your second question, could you please remind me for the second question?
The second question was the literature on the epidemiology burns that are
Okay.
in Ethiopia?
All right. So they did not distinguish between the types of burns that the burn cases that came. They wanted to know the knowledge and the practice of the caregivers of the patients with the burns. They didn't make a distinction, or they didn't make a distinction like with the types of burns that presented at the hospital. So
The reason this is because you could be in a burns injury, and maybe some of the practices are particularly to a certain kind of burn. For example, how you'll treat an electrical burn is quite different from how you'll treat a scalding burn, like from hot water contact. And also, it's different from how you'll treat a burn where there was a history of maybe enclosure in a burning building or something like that. So I was just curious what kind of burns, and this works with demography, and practices are quite limited to the geography. So I think that's interesting thing I was quite curious on. Yeah.
Yes, thank you, Benjamin. To add something, actually, this is going to be a limitation part of it because they did not focus on epidemiology. So they were just using the knowledge and attitude and the practice only. So maybe the next study can investigate more on the epidemiology of these burns so that we can recommend on, as you say, so we can know how to, maybe when an electrical burn or when it's just a car or any other type of burn, so we can know now investigate how we can manage them.
Yes. So actually, so what both of you said is really good. Future research can go into like the types of burn that present at the hospital. However, the only distinction that this paper made was whether it was a thermal injury, an electrical injury, or a chemical injury. So that's in the results section. But apart from that, there's no distinction between the types of thermal injuries, the types of electrical injuries, and the types of chemical injuries as well. So that's just by the way. That's the distinction. That's the only distinction that this paper has made. And Jesse, I see that your hand is up. Would you like to contribute to this answer?
Yeah, thank you very much. I think that was a nice question about whether or not the research question was comprehensive enough to cover the other types of burns. And for me, I have a different opinion. I think it's impossible to cover every type of burn that could happen, whether it's electrical, whether it's thermal, whether it's actually burns due to cold. So I think what the authors of the paper were thinking is looking at the most common causes of burn in low and middle income countries, in which they focused on one group, which is like children, who are usually most of the time due to thermal burns, specifically scalds. And they were definitely trying to look at the caregivers, because they are the ones who are like the determining factor on how well these children are taken care of, depending on the kind of quality of information they have. So I think even though it's not comprehensive, I think also in research you also have to be specific about, you can't look at everything at once. You have to kind of break your problem into different sections, starting with like a broad overview of the main things, and then now with successive researches you can look at the other causes of burns as well. Thank you.
Thank you very much, Jesse. So Benjamin, has your questions been answered?
Yeah, to some extent, they've covered it. I think as part of future recommendations, should maybe at least not go into depth, not too much into depth, but also just highlight maybe some of the caregivers that are coming. The people that are taking care of are mostly maybe thermal injuries, or are they pediatric kind of patients, or are they in the later decades? Also, what kind of degree of burns are we getting in the hospital, so that to guide maybe for predictive modeling, to guide future interventions for the hospital, and also for maybe the ministry in Ethiopia to be able to inform policy guidelines on, if it's pediatric, on maybe child protection or against bans, and also maybe if it's we're getting these bans from maybe lack of knowledge, to guide maybe awareness intervention, so that the problem actually comes out, because the whole point of research is determining what the problem is and creating a solution.
Yeah, that's a very good take on it. Yes, so the paper did talk about the number of thermal injuries they got, chemical injuries they got, and the electrical injuries, but they didn't go further into the types, whether it was pediatric or, as you just said. So that would be another great research area that people can do in the future. Thank you so much.
You're welcome.
Yeah, to add something on Benjamin argument. Yeah, actually this paper have a lot of limitation, and this is where the commentary comes. So it will be good if this paper was published recently, like in 2024. Based on Benjamin's argument, we could have written a commentary addressing on what they have left out, where the improvement is needed, especially the epidemiology and the causes. So which have a big
Yeah, thank you so much, Piel. So there's another question from Kigotho Karuku. So he asked, was the questionnaire used in another study, or was it developed by the researcher? So when I checked the paper, I wasn't really sure, because they didn't state that definitely, but I see that the questionnaire was pre-tested, so it wasn't like a questionnaire that they just brought up and then they started using it at the very beginning, but they tested it on a different community to see how effective it was. But to know whether or not they developed it themselves or they used like a very standard one, I'm not too sure about that. So that could be also another limitation, or a comment that
actually this is questionnaire they formulated by themselves. That's the main reason they were pre-testing it. When a questionnaire is already, if the questionnaire is adopted from other studies, so they can indicate that this questionnaire was adopted from other studies, so they will not have the need to test it again, because it was tested in other similar study and it was okay. So I think, though I don't have that clear evidence that it was a new questionnaire, but from the paper, it's highlighting that it's a new one.
That's great. So I put the link to the paper, the full text, in the chats right now. If you would like to look through as we discuss, you're welcome to do so. So we have a few more minutes to go. All right. So Brian, you have your hands raised.
Okay, thank you, Jonathan and Piel, for that wonderful presentation. So my question will be on the paper itself. Or sometimes when you browse through the internet looking for some paper, you can just look at the abstract and that will be it. So do you think, particularly on this paper, did they include all the relevant information that one can use by just reading the abstract? Sometimes I just read through the abstract for the papers while looking for some information.
Could you repeat your question again? I couldn't hear it too well.
My question is, do you think the information that was included in the abstract of this paper, was it relevant?
Was it relevant? Sorry, Brian, you got cut off just a bit. You said, was the information that they put in the abstract relevant to what?
Yeah, I got his question. So
okay.
So Brian is trying to ask that based on the abstract, is abstract enough for you to read it only? Because he's saying that when he's doing a literature review, maybe on the topic he's going to do a study on, he usually read the abstract only. So actually, abstract is just a whole summary of the paper, for which you can read the abstract and the conclusion, because actually methodology is meant for those who want to replicate the study. and we want to see how was this methodology conducted. But when we are just reading as someone who is going to write another paper or for literature review, so you can just read like in the abstract, and the conclusion can be enough to give you what you need. So that's how I usually do. Other people can suggest. Jonathan, please can.
Sure. I have no other extra comment to that. I think what you just said was very good. Brian, you have your hands up again? Or did that answer your question? Hello, Brian. Okay, I'm not sure if he hears us. However, let's move on to the next question. So Jesse, you put in the chat that it was not clear to me how they used the survey question to determine attitude as favorable or not. So in the full text, they did define what they interpreted as good attitude and not good attitude. I think, okay, let me just read it to you. So in the operational definition, under the method section, they defined some of the terms that they used. They defined caregivers, good knowledge, poor knowledge, favorable attitude, unfavorable attitude, good practice, poor practice. And there were 3 sections of the questionnaire that they administered. So there was the knowledge section, there was the attitude section, and the practice section. So their definition for the favorable attitude was an attitude score above or equal to the mean score was characterized as having a favorable attitude. And for unfavorable attitude, the attitude score below the mean score was characterized as unfavorable. So when you look through the full text, you actually see the tables there, which have the questions that were included in the questionnaire. And depending on their answer, they will know whether or not their interpretation will be whether or not it was favorable or not. So Jesse, does that answer your question?
Yes. I think that answers the question. The only place I had a trouble understanding is, and this is just my opinion, like if you say favorable is above average, then favorable is whoever scores above the average score. Then does that not introduce the bias that if the whole cohort has a more unfavorable what do you say attitude toward ban, then the people who have slightly above average would ideally not actually be favorable, as in there is that it's not very objective. And the other thing is like knowledge and attitude to me seemed like the same thing, like the same side, different sides of the same coin. So this is just my observation. I don't know, like how would you define yourself, the difference between knowledge and attitude, and how would you grade it?
I see. So yeah, that's a very good point. In many papers, the way the authors define their terms basically determines their interpretation of the results. And the questions that they asked within the knowledge section versus the questions that they asked during the attitude section, when you read through, you can actually tell there's a trend. However, you may not always agree with what the authors do, but for the paper itself, it's like that's how they defined it. So it does give you an opportunity to for future works to clearly define what the knowledge is and what the attitude is, and even clearly define it in a different way. However, with this paper, that's how they defined it. So there's not much we can do with that one, unfortunately. Yeah,
that's true. Yeah.
All right then. Piel, could you share the slides again? There is a section at the very end. So yes, let's discuss. So not that one. That one will take you to the very beginning. So if you can go back, yes. So yes, the one before, the slide before, 47, slide 47. Yes, and then you can go to the bottom right. The bottom right. There's an icon there for the yes. That should take you just here. Hopefully, yes. So thank you so much for all the questions that came, but there are just a few questions that we would like to address before we end this meeting. So was the study design appropriate for the research question? Do you think, those in the audience, do you think that the questionnaire was a good way of assessing, the knowledge, the attitude, and also the practices of the caregivers for this study? Anyone at all can unmute and answer.
Okay, maybe I can start. For me, I think it was not a bad way of investigating the research question, because it was something that was standard for everybody. Everybody got the same survey questions, and it was able to be standardized. But on the other hand, as Piel mentioned, it would have been better to have a mixed study approach, whereby we also get to get the quality of those responses. Maybe somebody might have more explanation to why they think, for example, their attitude towards giving a certain medication for the burn. So maybe we would have gotten more context using a mixed method approach. But I think in terms of practicality, this was a good way of getting standard information for everyone.
I see. That's great. Okay, so let's move to the next question. The methods. So to the audience, do you think the methods were clearly described? And I would like to state that the presentation that we made was a summary of the full text. That's why we sent the full text ahead of time, so that you could read through to understand it more clearly yourselves. But with everything that we know now, do you think that the methods were clearly described? Anyone at all can answer. For me personally, I would think that it was. What the authors did was described. We may disagree with what they did in their interpretation, but I think that they described what they did very well. Okay, so let's move on to the next question. Was the sample size representative of the population affected by the study phenomenon? So we didn't really get information in the background on how many people in Ethiopia, like we didn't get the numbers, the figure of how many people in Ethiopia do go through burn care. However, they used a standardized sample size calculator to get the number of participants that they wanted to include in this study. I think the only thing that they could have done to make this better is to give us some context on how many people in Ethiopia do get affected by burns. That's my comment. Does anyone else have a comment? Benjamin, you have your hands raised.
Yeah, that's where my earlier question came in, like the epidemiology. If we do, like, per year, how many burn victims are in Ethiopia, maybe even to the level of regions, like which region actually experiences more burns versus the other, and maybe why this happens. But even additionally, they used simple random sampling. If the text is right, what kind of simple random sampling algorithm was actually used? Was it just like convenience, like I found you in the ward, so you're in my study, you consented, you're in my study, or was it based off like each patient in the ward is given a number, then we take the in 5s or in 3s, or like what kind of algorithm was actually used? And also there are limitations to simple random sampling because it might not fully represent the epidemiology wise, because in that, especially for cross-sectional study, because in that time period maybe only maybe on that particular Tuesday only pediatric patients were in the ward, but in reality, over the full year, there are more, maybe adult patients who are bored. So I think it's an interesting thing to look at, and maybe go into detail in the future. Yeah,
I agree. That's a very good take on that. Thank you so much for contributing. Okay, so Piel, can you go to the next question? Oh, okay. Before that, Kigoto, you have a question. You'd like to make a contribution. You can unmute.
Okay. Hello. So I saw that the 25.3% is it mentioned before from their literature review when they're calculating the sample population size?
The 25.3%.
Yes.
Okay. Let me check the full text. Okay. So they made the assumption of 25.3, and they plugged that into the formula. So looking through the sample size determination and sampling procedure, I'll just read it through. It says sample size of this study was calculated using the single population proportion formula with the assumption of 25.3%. The prevalence of applying cold water, which is considered an appropriate pre-hospital intervention for burn injury, with 95% confidence interval and 5% margin of error. So the 25.3%, it's probably, so they have a reference here. They referenced the study that was done in 2021, investigating burn cases, knowledge, attitudes, and practices to burn care and prevention in Ethiopia. So I'm sure in this study, they found out that 25.3% of the caregivers apply cold water to their patients. And I'm sure that's what they used to determine the assumption of 25.3%. Does that answer your question?
Yeah, it does. Thank you.
All right. Very good. So let's move on to the next. The results. Were the findings statistically significant? And does the data justify the conclusions? So the conclusion was that there was poor knowledge, there was poor practice, but positive, I think there was positive attitude. Was that right, Piel?
Yes. Let me go back to conclusion.
Sure.
Are you seeing my screen?
Yes, I see your screen.
Yeah.
Yes. So, with the conclusions, with the results that we have, the general knowledge was low, and also with the cold water application, which I think is on the next slide. Cold water application, yes, wasn't so much among the caregivers. But however, the attitude, okay, we didn't include that in our presentation, but the attitude in the results of the study itself, when you read through the full text, was favorable. So I'm looking at the full text right now. It says 73.77% of all caregivers within the study had a positive attitude. And to understand what they mean by positive attitude, I invite all of you to go through the results section where they have the questions that they gave to the caregivers. And you'll see that you'll see from the questions that they gave, this is how the authors determined the meaning of favorable attitude or unfavorable attitude. So, was the finding statistically significant? And does the data justify the conclusion? I would say that the data justifies the conclusion. And I would also say that the findings were statistically significant, since there were a majority of the people who lacked knowledge and lacked the proper practice, but the majority had a favorable attitude towards burn care. So does that answer your question? Or okay, nobody answered the question. So let's move on to the next slide. So who funded the research? That was stated in the paper really well. So I think we can move on to the next question. And did the authors acquire approval from an ethics board? Yes, they mentioned that they acquired approval. Did they have any conflicts of interest to be discussed? No, they did not have anything. What are the specific limitations of the study? I think the authors described some of them very well, and we also identified some quite well as well. So that's pretty good. So now it's 1 hour since the meeting has started, and I think it'll be a great time to close. And I'd like to thank everyone for contributing in this discussion. I think it was a very good first AfroPRS Journal Club. I really loved how all of you had your questions, which I never also thought of myself. We're all learning in this. Kigotho, Benjamin, Jesse, and the rest. You guys had very great questions. I appreciate you for that. And Piel, thank you so much for doing a very great presentation. I look forward to more in the future, especially with the Research Fellowship Program. I'd like to invite all of you to who wants to be a part of the Research Fellowship Program to finish all the requirements that were stated in the checklist before December 31st. That's in 2 days. However, if you can't make it for this one, we'll have another one in 6 months. So I look forward to that. And may all of you have a very Merry Christmas and a Happy New Year. Thank you so much for joining.
Yeah. Thank you, everyone. From those Ben and Jesse, we are from White Teaching and Referral Hospital. Actually, we can try, because they mentioned that burn care in low and middle income countries, the perception, which is the knowledge and attitude and the practice is very low from this study, which we can do the same study, and then we try to improve the methodology they used. So I think actually it's a good study. Even if you read the studies, all few studies has been done. Even it was from the introduction, they said that the problem was with the existing literature, because all few studies has been done based on the burn injuries in Ethiopia, and this can apply to many of our African countries. So it's a good study.
Yes. Thank you so much for that, Piel. Thank you very much, everyone, for joining. I wish you a very Happy New Year.
Yeah. Bye-bye.